everyone. Thank you so much for your patience. We've had some technical difficulties on our end, so thank you so much for hanging in there. I'm Meredith Raymond with ACL, and welcome to our webinar, Aging with and Into Disability, the California Grassroots Collaboration. There are many similarities in the services and supports older adults and people with disabilities need to live independently as they age, and increasingly, the aging and disability networks are working together at state and local levels to better support people aging with and into disabilities. Today, ACL is delighted to highlight successful aging and disability collaborative initiatives in California. First, we will hear from Anna Acton, Deputy Director of Independent Living and Community Access Division at the California Department of Rehabilitation. Next, we will hear from Eli Jalardin, Executive Director of the Marin Center for Independent Living. And finally, Cindy Kaufman, the Deputy Director of Community Services at the San Francisco Department of Disability and Aging Services. The webinar will conclude with a brief question and answer session, and please post any questions you have in the Q&A feature in Zoom. The webinar recording and PowerPoint will be posted on the ACL website. Thank you again, everyone, for your patience. Take it away, Anna.
Thank you so much, Meredith. Great to be here with all of you today. My name's Anna Acton. I'm the Deputy Director for the California Department of Rehabilitation's Independent Living and Assistive Technology, Independent Living and Community Access Division. So within this division in California, well, let me start by saying the Department of Rehab is the state's vocational rehabilitation program. And we also, within the division for the Independent Living Community Access Division, we have the network of independent living centers, our assistive technology program, and our traumatic brain injury program here within the division. So let me just start also by saying that prior to coming to the Department of Rehabilitation and working statewide with the network of independent living centers and other stakeholders, I actually worked at the local level as an executive director of an independent living center. So I have that local level experience that I'm able to bring to the statewide work that we do and that we're going to talk about today. So we're really going to be bridging that local and statewide work around disability and aging. So we'll go on to the next slide. And to the next one. So I want to talk a little bit about what the Independent Living Network looks like in California. So we have our State Independent Living Council, right? This is the entity, the group, the body that does the monitoring, review, and evaluation and implementation of the state plan for independent living, right? The Independent Living Network, including the State Independent Living Council, is really supported through the Rehabilitation Act, or the Workforce Investment and Opportunity Act, as we now call it. And it also includes the Department of Rehabilitation as the designated state entity. So that State Independent Living Council develops the state plan for independent living, and we at the Department of Rehabilitation administer the funding in alignment with that state plan. And we also distribute the Rehabilitation Act Title 7B funding here for the state of California. So it's a very close partnership. We work very closely together to advance independent living for people with disabilities in California. As part of our network, we have 28 independent living centers in the state of California. So these independent living centers are peer-run, peer-delivered organizations that provide services through really consumer-driven models of service delivery. And they're required to provide a variety of services, both federal core services, such as independent living skills training, individual and systems advocacy, peer counseling, information referral, transition and diversion services. And then in California, we also provide, besides the Rehab Act funding, we provide state funds and investments into the Independent Living Network. And we require them to provide additional core services, including housing, personal assistance services, and assistive technology services. Now, remember, these services are peer-delivered, consumer-driven, and are cross-disability, meaning this network of providers provides services to people regardless of type of disability the person has, regardless of what age the individual is, and actually regardless of what income they are as well. And really all the services are designed to increase independence and community living. And so this network really bridges this local, right, providers to statewide network of organizations dedicated to independent and community living for people with disabilities. We'll go on to the next slide. So I was asked to talk a little bit about grassroots advocacy, and I'm going to kind of wind this into the rest of the slides. But I wanted to kind of start here because I think this is really important, at least in California. I've been involved in the independent living movement since about 20 years. I've been involved both at the local level and now state level. And a lot of the work around bridging disability and aging, from my experience, really has started at that grassroots level. We saw early on when I first got involved in this work that leadership at the local level was really working to bridge disability and aging. And what we know is that's really where all the magic happens around services and around people getting access to the supports they need to prevent them from going into a higher level of care and to really remain living in the community. And so what we've seen here in California is really that local relationship building, right? Really coming together at that local level because of really working with shared consumers, individuals who may need services from multiple different systems to really live in the community. And what we saw really early on was that building of relationships and really working at that local level. Now, it hasn't always been easy with this work, and I'll talk a little bit more about that, but this was really an opportunity to come together at the local level, and I've seen it firsthand. We're really coming together, talking about disability, talking about aging, talking about stereotypes that the different networks may have had. Early on, I feel like there was a lot of misconceptions and stereotypes around the independent living centers and what they did and what their goals and what their motivation was around supporting people with disabilities, and vice versa. We see that on the aging side as well, but there's a lot of misconceptions about the aging networks. And so at the local level, these conversations really started to come together. And what happened was that many of the aging and disability networks started finding shared values and goals, right? That even though they may have had different ways of providing services, different kind of histories in service provision and advocacy work even, that really coming together and finding those shared goals and values. So really became critical to come to the table together. And that not only started locally, but then started transcending to statewide work. We had multiple different kind of advocacy initiatives and organizations working on this, including the California Foundation for Independent Living Centers. This is a network, the membership organization for the 28 independent living centers in California. We also have the California Association of Area Agencies on Aging. So both of these, and that's the membership organization for the Area Agencies on Aging, both of these really working with their local organizations, the local disability and aging providers, to ensure that there was a voice on the statewide level, really using that local grassroots voice and experience that was happening at the local level and percolating it up, so to speak, bringing it up to statewide discussions and tables around policy and advancing disability and aging initiatives. We also had a couple really critical grassroots initiatives that I think are worth mentioning here, and that's the California Advocacy Network. So we've seen these broader networks of organizations coming together. The California Advocacy Network is a statewide movement of over 1,000 organizations with over 300 affiliated members of all different organizations, not just the area agencies on aging and the independent living centers, but we're talking about health plans, we're talking about senior programs, we're talking about those representing individuals with developmental disabilities, and really spanning urban and rural communities, those health plans and community-based organizations and providers. This also included the California Collaborative, the Scown Foundation, I want to say, and their regional coalitions. This ended up being a huge game changer on bridging local work with statewide policy, where we had regional coalitions really coming together, disability and aging networks working together to advance community-based services for people with disabilities and older adults. And then, of course, the California Collaborative on Long-Term Services and Supports has played this vital role, again, coming together, statewide, local organizations, statewide organizations coming together to be at the table to advance policy. So I'm going to go on to the next slide here and talk about why, right? There really was a coming together of a common issue that both the disability community and aging communities were experiencing. And this was navigating long-term services and supports. So long-term services and supports being basically, in my definition, any service and support that people with disabilities, older adults, caregivers need to be able to live in their community of choice and be able to get the supports they need when they need it. So the problem has really been navigating through the fragmentation and maze of long-term services and supports. And we know that this is daunting for people. Those of us, I'm a person with a disability myself, even when I go to access the services and supports that I need, and you think I would know and have some experience in this by now after 20 years, it can be very difficult. So imagine, right? Those local providers working with individuals that are experiencing this, trying to support them and navigating to the services they might be eligible for and that they need. This ended up being a common issue that everyone could agree upon. And you really saw that with both the independent living centers, the area agencies on aging, and other disability and aging networks coming together around this issue. We know that both disability and aging, often those of us, we have very similar needs. Whether you're talking about a younger, I'll call myself person with a disability still, not an older adult yet, and older individuals who might be aging into disability, needing those long-term services and supports, we often need very similar things. Our goals might be different. We might be at different points in our lives, right? But we need affordable, accessible housing, accessible transportation, personal attendant, caregiver support, access to healthcare, assistive technology, durable medical equipment, right? The functional needs of our communities that we serve are often very similar. And historically, we haven't always worked together, right? So as I mentioned before, really early on, these conversations weren't always easy. There were certain assumptions around the disability community and advocacy community about not understanding disability, that maybe we didn't care about the safety of people with disabilities, and that we were all about getting people out of institutions and wanting to eliminate institutionalization. And then on the senior organizations or older adult organizations, sometimes there's a misunderstanding about disability, not knowing how to provide accommodations and services to those with the most complex disabilities that were older adults, right? Really, there was misconceptions that they believed in institutionalization, that everyone needed to be safe and in an institution. Well, coming together at the local level, and even through my own personal experience firsthand, seeing how having these conversations weren't always easy early on, it gave us an opportunity to understand and find those common values and realize that, there's a continuum of care. There's a continuum of need in the community. And that by working together and finding those common values and goals, we're able to be stronger. If we lift one boat, right, we're able to lift boats for everyone. So I'm going to go to the next slide and talk a little bit about the history, I'll say, of California disability and aging, California's Aging and Disability Resource Connection history. Because those local level conversations and the aging and disability resource connections, which are really designed to streamline access for long-term services and supports, in California, many of the conversations and the work started at the local level. Okay, and that work really started with bringing the right network of providers together, having difficult conversations, having really exciting conversations, and finding those core values. But this history of getting to the aging and disability resource connections, which I'm going to talk a little bit more about next, really kind of came through a series of events, right? On the federal, as well as state level. One, of course, we had the 1999 U.S. Supreme Court Olmstead decision, right, that really gave built off of the Americans with Disabilities Act, right, and gave the ability and kind of focus that people with disabilities should be able to live in the least restrictive environment, and that those supports and services and that funding that we would use to support someone in an institutional setting should really follow that person into the community and so they could live in their setting of choice. We then in 2003 had the Federal Administration for Community Living and Center for Medicare and Medicaid Services that began funding our Aging and Disability Resource Connection grants throughout the United States. Those are the first grants that I recall and I'm aware of that really started funding this idea of bringing together aging and disability to coordinate services at the local level. Right in 2006, we had the ADRC was defined in the reauthorization of the Older Americans Act. In 2012, we actually had the establishment of California's Aging and Disability Resource Connection designation criteria. It was around the 2010 or so that actually California received some of the first funding through the Administration of Community Living to help with the establishment of Aging and Disability Resource Connections. And actually in California, it was a state independent living council that got that first money for ADRCs and granted it out to a few local communities in California to see what this ADRC initiative, this cross-section of aging and disability might look like at the local level, and really used it as kind of a foundation to build upon to see what would a state model look like for California. So this funded, I want to say 3 to 5 local grants. I was at the local level and was able to utilize actually that first funding for ADRCs in California to develop a business plan for ADRC, to bring together the AAA and the Independent Living Center, and to really see what would this look like? How can we work across systems to ensure people get easy access to the services they need in a timely manner? So that then led into 2012 with the establishment of the California ADRC designation criteria. In 2014, you saw the ADRC program move from the Department of Healthcare Services actually to the Department of Aging, where it is, which leads the initiative today. And then in 2015, we had the reauthorization of the Rehabilitation Act, which moved the independent living program from the Department of Education to the Administration of Community Living. And the reason I wanted to mention this is this is really a federal initiative, right? So there's some federal funding going out, there's local work being done to bridge aging and disability, there's state work now in California being done, but there's also this another initiative on the federal level that really intentionally kind of took the independent living program that was housed under the Department of Education, Rehabilitation Services Administration, and brought it over to Health and Human Services, right? Brought it over under Administration on Community Living with the idea that maybe we could better coordinate services under the same umbrella for Older Americans Act, bringing the Rehab Act there for independent living. We have developmental disability services and traumatic brain injury, right? So another kind of work to kind of bridge these efforts, federal, state, and local. In 2017, we had AB 1200, which actually established the ADRCs into state law. In 1999, we had the passage of multiple different bills, basically to continue the implementation of ADRCs, including funding for ADRCs. And then in 2021, we had the Master Plan from Aging was released right in the middle of the pandemic. And we also had the first ADRC funding roll out to local communities that you're going to hear from after my presentation. So we'll go to the next one. Now, with the establishment of ADRCs in California, we did something that I'm not sure is, I feel it's a little bit unique for the nation. That is that one of the requirements of that ADRC, because remember, it's aging and disability, is that we require this to be a core partnership between an area agency on aging, right, serving those over the age of 60. We have 30 some here in California, 33, I believe. Don't quote me. And then with the Independent Living Center that serves people of all ages with any type of disability, right? So this is a core partnership bringing together aging and disability. So this work really was codified into law in 2019 as this partnership between aging and disability, the Area Agency on Aging and the Independent Living Center. And we'll go to the next slide. It also requires ADRCs in California to have these 4 kind of ADRC service functions. That's enhanced information and referral or assistance, where we provide not just referrals, we provide warm handoffs. We really work to connect people directly to the services they need to the warm handoff. We provide follow-up. We provide these services in hours that are convenient and easily accessible to the public. Also, short-term service coordination, which is really looking to make sure when people connect and they have a very urgent need that might require them to basically be at risk for being institutionalized, being hospitalized, that there's a mechanism and a system, a method to ensure people are assessed for that urgent need and are prioritized and get connected to the services they need to prevent that institutionalization, sort of a diversion service in my mind. And then options counseling, which is really making sure people have get the support to understand what long-term services and supports are available, both public and private, regardless of what income the individual is, and to really help that person through a person-centered planning process and support to understand what their options are and to be able to make informed decisions about the services that they're going to access. And then lastly is transition services, right? Really supporting individuals that are transitioning from hospital to home, from skilled nursing or other institutional setting to the community. What we know is those transitional moments in people's lives are really critical. And it's when people often need the services the most and that support to prevent exacerbation of health conditions, of disability, or being institutionalized. So we'll go to the next slide. So as part of this work in California, we have our ADRC Advisory Committee. And actually, you'll be hearing from Eli Gilardin and Cindy Kaufman, who are currently the co-chairs of the ADRC Advisory Committee here. But again, this is bridging disability and aging. We have aging organizations, disability organizations, state representatives from multiple state departments coming together to plan around the ADRCs. In 2015, we had the Long-Term Services and Supports Advisory Committee, which established the ADRC Advisory Committee. So it's been going on for a few years here. I even had the opportunity to co-chair the ADRC Advisory Committee prior to coming to the state. And it's always been kind of co-chaired, as far as I can remember, anyways, between a disability organization, like you're going to hear from Eli, and an aging organization, like you're going to hear from Cindy. So really bridging it again. In 2019, the ADRC Advisory Committee really began to serve as the primary advisor to the state and the development and implementation of the No Wrong Door system, including providing formal recommendations, serving as a forum for stakeholders, and really being that disability and aging partnership at its core. So what's interesting is at the local level, I saw many local communities 20 years back finding their local advisory committees and bodies to really start bringing the partners. If it was a disability advisory body, bringing in the aging partners, or vice versa. And then you see here, even at the state level, where it really started as this long-term service and support advisory committee, we kind of use that as the foundation to really build it for an aging and disability advisory committee for our No Wrong Door efforts and ADRC efforts. So we'll go to the next slide. So really, there's been multiple investments in the state here for ADRCs. We had starting in fiscal year 22-23, We invested $10 million at the state level for aging and disability resource connections in California. We have 1.9 million in state operations to support the ADRC initiative at the state level. We have some other investments included 9.4 million in older adults recovery and resiliency. This was one-time funding available through March of this year. And actually, I think it was extended for a little bit for technology to connect consumers to information and services. I believe this is American Rescue Act funding as part of the pandemic recovery. And then $5 million for home and community-based services. Again, this was through American Rescue Act. It was one-time funding through September or maybe even December of this year now for customer relations management system to improve data collection and reporting capabilities. So there's been a lot of work kind of to help think through how do we support our local aging and disability resource connections as a state, and also ensure that people have access to the services they need statewide. So we'll go to the next one. So the ADRCs have really grown over the years since we've been involved. It started with just a couple state designated ADRCs in California, as I recall. At this point, through the development of our ADRC state designation criteria, that's really informed by the ADRC Advisory Committee. We have 24 state designated ADRCs in California. Now, this is not statewide coverage yet, and we know that there is more to go, but we're really excited to be at this point where we have the 24 local partnerships, Area Agency on Aging, Independent Living Center, and they're fully state designated to meet the standards for an aging and disability resource connection. And then we have two emerging ones. So we have kind of two methods. Emerging means they're still working on developing full state designation and meeting full state designation criteria. So hopefully before too long, we'll have 26 ADRCs in California. So what's driving this? And I really want to speak to this. We can go to the next slide. And I'm going to kind of move through these fairly quickly because I want to give good time for Eli and Cindy to do their piece. But let's be real about this, right? There is a lot of urgency right now that is helping to drive the work we're doing in disability and aging. And this is not just a California issue. This is a national issue, as all of you, I'm sure, are aware. We know that the aging population is just growing exponentially. And in California, we're at the forefront of decade-long demographic shift that we've never seen before in California. So for the first time, older adults and the older adult population will outpace the growth of the 0 to 18 population. We're experiencing a rapid rise in the 85-year plus age population. And all the while, the aging population will continue to diversify, right? Soon becoming a majority minority. We're going to see major growth in the number of LGBTQIA plus individuals who are older adults, also demographic shifting within all places in the state. And we're seeing that even more so in certain areas, right? So we know also that this is really pushing urgency within the state's administration and priorities, and really has helped lead us to the master plan on aging that was developed in 2021. I also want to mention this is not just for this is not just for the Area Agency on Aging and older adult service delivery system. We're seeing this impact already within the disability network. We're seeing those with developmental disabilities living longer than ever and, having the opportunity to grow older and age. We're seeing independent living centers right now who are 50% of their consumers are over the age of 60 right now. So this is really driving. We know with age also comes the increased probability of disability. So the next slide, this was a driving force with the master plan on aging. And we saw the governor Newsom here in California really make this a top priority through an executive order that really drove the development of the Master Plan on Aging, which was released in January 2021. And it has 5 bold goals, 23 strategies, and 132 initiatives, right, within that Master Plan on Aging. And I don't have the opportunity to go into all of it, but goal 1 is around housing for all ages and stages, a major issue for our communities. Goal 2 is health reimagined, which has really driven a lot with our rollout of Medi-Cal and managed care in California. We have goal 3, which is inclusion and equity, not isolation. Goal 4 is around caregiving that works, and goal 5 is about affordability and financing and being able to afford aging. So I want to highlight Initiative 98, which we're kind of focusing in our ADRCs and no wrong door work here. But it was really to build out a no wrong door or one door statewide system for public information and assistance on aging, disability, dementia, and that this would be done through a web portal, a statewide network of local ADRCs with shared training, tools, technology, and continual improvements to ensure cultural competency and accessibility of services, not just at the state level, but at the local level. We'll go to the next one. So as part of this, I wanted to mention the real systems change that is occurring right now through this Master Plan on Aging to really ensure the long-term services and support system in California works for individuals who need it. So through the systems change work of the Master Plan, we kind of have 4 buckets here. We have navigation, which is really ensuring people can easily navigate, right, through a no wrong door type system, the services that they might be eligible for and that they can benefit from. We also have access, right? So people need to have access to the programs and services that they need. And as part of that effort, for navigation, we've been doing, we actually have a California 2030 initiative I'll talk about. For access, we've actually been working, Department of Aging has been doing a home and community-based services gap analysis and roadmap, and so is the Department of Healthcare Services, looking at both Medi-Cal funded, Medicaid funded services and non-Medicaid funded services within California and seeing what exists and where the gaps are in long-term services and supports. And then the other piece is really looking at the workforce. We know with the aging population, with the increase of people with disabilities, we know we have to build out a strong workforce, that direct care workforce, both to support the informal family caregivers and support systems and the formal workforce to ensure they have access to the supports they need and that they have the wages and benefits needed to be able to maintain that workforce. And then lastly is financing, right? Long-term services and supports financing and affordability is a key piece of all this, right? We have a long-term care insurance task force that's looking at this, but this is really seeing how do we make aging and disability more affordable? How do we ensure people can pay for the services that they need without having to spin down to poverty as well to be able to access those services that might only otherwise be available through Medicaid? So the next piece that I wanted to speak to is really that navigation piece. We've talked to this, but really looking to build California's no wrong door system, really leveraging a statewide system to connect with those local providers, and really streamlining and promoting access to information. And I'm going to go to the next slide here. Okay, so key elements, you can go to the next slide, of the no wrong door system is really that federal partners and states work to develop and refine a framework that helps to align a fragmented infrastructure of long-term services and supports and benefits into a coordinated no wrong door system. And the 4 key elements are really public outreach and coordination with key referral sources. So we need a way for the public, for people who are connected to the system, to a system, disability and aging system, to get access, but even more importantly, people who are not connected, people who may go to their church, they might use public transit, but they're not actually connected maybe to a traditional service delivery system. do we outreach to them, and how do we get them connected to the resources they need? The second piece is person-centered counseling, ensuring that services are delivered through a person-centered model, right? That really leverages the person's strengths and needs and desires to get connected to what they need. Streamline eligibility for public programs is another key element, and then state governance and administration. So for years in California, the local community had really been trying to work to address those first things, outreach, local coordination, person-centered services. But really, over the last couple of years, the state has really been leaning into that leadership role and making sure we have a robust no wrong door system in California. And we'll go to the next slide. So in California, we've just recently, this year, actually developed our No Wrong Door State Leadership Council. And this is really creating a no wrong door system for, again, long-term services and supports, and developing streamlined experience for people to access the services they need across multiple systems, multiple funding sources, multiple state departments. That each may have their own eligibility, right, requirements. So this effort started in 2024. And the vision is that California can readily access and navigate information and resources through aging and disability no wrong door system to make informed decisions based on their needs and desires. This is really a statewide effort to make sure we're leveraging that local network of providers and getting people connected, but creating consistency and a way for people to get connected wherever they're at. And we'll go to the next slide.
Hey, Anna, if you could wrap up in the next minute or so, we're running low on time. Thank you so much. This is great.
Absolutely. So as part of that no wrong door system, and I'll end with this slide, that we're going to look to develop a statewide kind of portal for accessing information for California, an online resource, eventually a call center, so that people with disabilities, older adults, and caregivers can get connected to information, and then be able to navigate to those local or other statewide services that they need, and at the local level or where they need it. And so that's sort of what's ahead. That's what we're working on right now, is really building out this no wrong door system for the state. And with that, I do want to give it over to Eli. I'm so sorry it's taken so long. I apologize. I'll give it to you. And Eli is just such a great example of what's happening at that local level. Thank you.
Anna, thank you so much. Thank you for your leadership. I think we're a stronger aging and disability network because of much of your work, as well as your colleagues at both DOR and California Department of Aging. In the interest of time, I'm going to try to do this in 5 minutes. So I'm going to skip my bio, other than to say Eli Gillardin, CEO, Executive Director of Marin Center for Independent Living. I've been in my role for 16 years. Do we need to pause for the interpreters to switch, or are we good on that?
I think we're good.
Okay, great. This is our welcome slide. This is a park in Marin, a middle-aged little person and a middle-aged average height person, both advocates and volunteers at Marin Center for Independent Living, connecting in our first in-person during COVID. It's one of my disabled joy pictures, so I always hold on to it for all the reasons we do this work. Next slide. Our mission, empowering individuals with all types of disabilities to achieve their maximum level of sustainable independence as contributing, responsible, and equal participants in society. Next slide. Since 1979, Marin Center for Independent Living has been the leading community-based, peer-led disability rights organization for Marin's access and functional needs community. I use that term intentionally because over time, we've seen disability and the definition of disability expand. We've seen climate change, COVID, other natural disasters impacting multiply marginalized community members, including caregivers, certainly including older adults and people with disabilities. including the intergenerational aging and disability community. Next slide. So Anna did a great job of outlining our state and federal core services. I'm not going to go into that in detail other than to say, kind of as an umbrella to the state and federal core services, Marin CIL has categorized community impacts. These are areas where we're really moving the needle on equity for our access and functional needs community. This includes housing support and preservation, everything from transition and diversion to home modifications, to administering the Community Living Fund in California. And I'm proud that we're one of the top administrators of that fund in the state. And certainly ensuring that folks transition from hospital to home or are diverted from entering facilities in the first place. When we talk about meaningful access to care, this is often the navigation of healthcare services. It includes case management and integrating healthcare initiatives like CalAIM, Medi-Cal, Medicaid realignment, as well as veterans-directed care, which is newer on the West Coast. It also includes caregiving support, and we center, because we are in a community that has the highest rate of older adults aging into disability in the state, we provide a lot of caregiving support services. Community resilience, which I touched on a little bit already, really recognizing climate change, COVID, and how we're supporting our community during these extreme weather conditions. We provide high voltage batteries through a contract with PG&E. We provide temporary housing and sheltering when disasters do hit and people with disabilities need accessible housing. Digital equity, certainly during COVID, seeing the digital divide and those that have access to the internet and technology versus those that don't, and kind of really distributing a variety of technology, including laptops, Chromebooks, as well as doing digital literacy training. And finally, disability rights advocacy, which Anna touched on. I will just add that we are very proud more recently to learn that we will be administering the community or systems change community organizing network for the state. Marin CIL deeply believes that advocacy is the ultimate strategy to moving equity forward for our aging and disabled community. Next slide. Some quick snapshot of services. We served over 2,000 folks last year, the majority over the age of 60. Marin is a predominantly white Caucasian community, but we are proud that we do have an intersectional lens to the community that's Marin CIL services that touches race, disability, and is intergenerational in age and background. Next slide. So One Door, which is our community's aging and disability resource connection, established in 2018, shortly after that updated designation that Anna discussed at the state level. We were the sixth state designated ADRC. And so we've been around for a few years and we've learned quite a bit. Next slide. It's not captured on this slide, but we really see our ADRC as the intersection of the disability community, older adults, as well as caregivers and family caregivers, serving, again, that broader access and functional needs community. Next slide. Anna touched on the core services of ADRCs, so I'm not going to dive into those. Again, in Marin, this is a partnership between our area on aging, Marin Aging and Adult Services, and Marin Center for Independent Living. We are the designated core partners. We have extended partners in that network, including our federally qualified health center, our ombudsman program, paratransit services, and other CBOs. Next slide. This is a visual image showing that One Door resource. So the One Door is how community members come into services of our ADRC, whether that's provided directly through our two organizations or referred out through that information and referral network to a variety of different partners representing everything from homelessness to veterans to rural to urban services. Next slide. Uh, we already touched on the key components. What I really want to just say is it centers on trust, relationship building, communication, and I think over time we've really built a great rapport with our AAA partner, leaning in to all of the core services and meeting on a regular basis to ensure that documentation of referrals, best practices are all modeled and integrated as we evolve our ADRC. Next slide. I'm going to skip the consumer story because it will take me too long, other than to say we do great work and impact lots of community members, particularly during the pandemic. Next slide. And I'm also going to skip this slide. As I said, we provide a lot of good work, particularly during COVID. Next slide. Beyond our ADRC, we work in coalition with Marin Aging and Disability Institute, an entity which we co-founded. Next slide. Really recognizing the intersection again of aging and disability and doing innovation and coalition building. Next slide. Everything from aging and disability friendly planning for our cities and counties in Marin, funded by grants from California Department of Aging. Next slide. To combating ageism and ableism, working at the county level to train all health and human service staff on the terms ableism and ageism, how that's internalized, how it's externalized, and how we can move forward on greater equity with the intersection of racism. Next slide. So that's it. I'm going to pass it over to Cindy.
Thank you, Eli. I will do the same. I am, brief introduction, Cindy Kaufman. I'm the Deputy Director of Community Services with the Department of Disability and Aging Services. Next slide. So next slide. I forgot they were in pieces. One more. There we go. So the vision of our department is to have a city where people with disabilities and older adults are valued, engaged, and living with dignity. We bring compassion, accountability, inclusion, equity, and innovation as our underlying core values. Next slide. So this is a bit of a busy slide. It gives you our departmental structure. We provide both direct services, which you can see on the left through adult protective services and supportive services and conservatorship programs. I would like to focus on the right-hand side and focus on two of our programs on community services. The first is the Office of Community Partnerships, which actually serves as our area agency on aging. We do not provide those services directly. We contract with more than 60 agencies and over 250 contracts. So it is truly a partnership. Services include nutrition, community services, care management, LGBTQIA services, technology programs. The list does go on and on. And then the other service I would like to focus on is DOS Integrated Intake and Referral Unit, which is part of our Benefits and Resource Hub. And this provides intakes for our direct services that I mentioned, but also some of our community services, such as citywide case management, home delivered meals, and the intensive transition case management program called the Community Living Fund, which I'll mention again in a little bit. And these last three programs are also part of the contracts that we have through the Office of Community Partnerships. So intake provides information and referral also to many, many other services outside direct programs, as well as our contracted providers. So where our Office of Community Partnerships serves as our area agency on aging, integrated intake is the doorway into all of those services and others. Next slide. This slide just shows that we provide really a continuum of care in providing services to meet people where they are at in the morning, all the way from engagement and wellness through finally to guardianship services. Next slide. So this gives you a snapshot of the caseloads from some of our larger programs. Integrated intake provided over 15,000 intakes in fiscal year 22-23. And Office of Community Partnerships served over 60,000 unique individuals for a total of 141,000 enrollments into services. Meals are some of our biggest, with over 17,000 in congregate, over 6,000 in home delivered, and then over 16,000 in activity programming. Next slide. This just shows the diversity of San Francisco. We have a large Asian Pacific Islander population with over 40% Chinese, and 36% are Chinese speaking. Next slide. So both Anna and Eli did great jobs in talking about the Age and Disability Resource Connector. Our core partners, we are the integrated intake serves as our entry. We partner with our Independent Living Resource Center, which is a great partnership. We balance each other very well. It allows us to serve a wide spectrum of ages, but especially those younger adults with disabilities. And then our third core partner is the Institute on Aging and the Community Living Fund. And the goal there is to prevent premature institutionalization and to help people who are able to transition out of skilled nursing back into the community. It's a two-pronged approach, both intensive case management as well as purchased services like stair lifts. We have got a lot of Victorians, home care, medical equipment, allowing people to stay in their homes. And then we have extended partners. So while DOS Intake and Independent Living Resource Center and Community Living Fund are the core, they are our Age and Disability Resource Connector. The extended partners are we call Age and Disability Resource Centers. And the goal is to have many ADRCs in every district of San Francisco. They are a trusted source because they are part of the community, allows more diversity and easy access. Next slide. Okay, this just goes back to the core services and some of the areas that we specialize. Next slide. Gives totals of we're very proud of the work we do. Our partnerships actually allow us to serve way more people. Next slide. I'm going to highlight 4 really brief Dignity Fund campaign. Next slide is a voter approved ballot measure that allows for set aside funding. So we get funding, guaranteed funding every year, specifically for the populations we serve, and allows that funding to grow over the years. It also is part of a community needs assessment, as well as, based on the needs assessment, a service and allocation plan. Next slide. Age and disability friendly. I know lots of you are very familiar. We're in our 3rd cycle. We have 4-year cycles. We're in our 2nd, nearing our 3rd. Some of the highlights are expanding crosswalk times, launching a Reframing Aging, and launching a Disability Cultural Center. Next slide, please. So ending ageism, I know Eli commented on that. We did a whole campaign to disrupt how the negative stereotypes of aging come across, and it was a great campaign. And it really hit a lot of people, was all over San Francisco, both social media, in buses, and it refocused into positive aging. Things like creativity never gets old, intelligence never gets old. Next slide. And then the Disability Cultural Center. This is last but certainly not least. We contracted with the Paul K. Longmore Institute to assess the need for a community cultural center. Their research verified that there is a need. There was discrimination in San Francisco against people with disabilities. There was a need for communities to have a dedicated place to feel safe and connect with others, and then also to celebrate disability identity and culture. So we launched a request for proposals, received RFPs back. Elsie and Lily Cox Haven of Hope was awarded the contract, and we launched the nation's first municipally funded cultural center led by and centering the disability community. They launched last July virtually, and then their brick and mortar will launch this next July, just in time to celebrate the 35th anniversary for the ADA, which we're very excited about. And that is it for me.
Well, thank you so much for all of your presentations, and especially Cindy and Eli for very quick, informative presentations at the end. We unfortunately do not have time for Q&A, but the slides and the webinar recording will be posted to our website. And also, if you have any questions, I will put my email in the chat. It's meredith.raymond@acl.hhs.gov, and I can answer them or refer you to our speakers. So thank you again, everyone, for joining us, and enjoy the rest of your day. Thank you.